Now, gynecomastia, like many procedures, has different elements of difficulty, and that's due to the grading of the particular problem or condition. And gynecomastia does have different grades or different degrees of seriousness, if you like, in terms of how much or how little one has. But it can be a bit confusing even for surgeons, because the grading systems can vary between individuals and how we grade these things. So there's not one universal classification that we all accept, that we abide by. So I think that's important for patients to understand. And also, it's not just based on what visually it looks like, because you can have somebody who's got, what looks like very large, droopy breasts on a man, but yet there might be other elements within that condition that actually add or subtract difficulties in doing it, such as the skin quality, how much gland or tissue they have, how much fat they have, how much spring is in their skin. There's all these elements that one can't sort of finally judge until you actually examine the patient and see them, because only then you can get an overall good view of how difficult or how easy, if you like, in parentheses, this is going to be to correct. And so once you've done that, then you're in a better position to try to explain to a patient why they need this approach or that approach. I don't think it's right just to try to give a blanket grading for anybody and just sort of say, oh yeah, you're grade 1, grade 2 or 3, because it doesn't mean anything in itself. I think everything has to be quantified these days, and so that's what we do here at the clinic. We don't sort of commit to a certain grade until I've actually seen the patient, examined the patient, felt his skin, looked at it, see how the skin responds, and then I can give a much more measured sort of outlook and approach to how I'm going to deal with the problem and tell them what the chances of success or not there are.